MRI in this video looks strange, right? I got up one day morning, a call from a radiologist saying that my MRI done yesterday shows signs of sphenoidal tumor. This is when I started reflecting. How does it feel to be on the other side of the bitter pill? That's when I personally realized the importance of faith. Faith in self, faith in the healer, and everything else. This video is all about the importance of faith in healing. There are demons in our mind which makes us believe and prove sometimes that faith is not true science. However, there is enough evidence that faith and being positive helps in healing. To convince you, I have a real life example on Parkinson's disease and references stating that the psychological state can alter inflammation. We are always in two minds when we prescribe a placebo. Do we believe in placebo? I'm sure it's just not a powerless tool. It's powerful if you believe in it. Can we use this faith? Faith which can bring the same placebo effect? To do this, we had to first trigger off patient's own internal pharmacy. To introduce this concept, we bring in what we call as a theater of healing. Before we enter the theater of healing, we need to scrub. What does scrub mean here? It is tiny clues of how you walk, dress, interact. Everything triggers off a chain of reaction which adds up to your aura in healing. There are 5 cardinal rules in our theater of healing. The first rule is be a good listener. To infuse faith, we had to be very good listeners. Let's look at an example. Dr. A, who's tired. He's not looking at the eye of the patient. He looks very distracted. In between, he misses everything. Dr. B has got very good eye contact. He listens, uninterrupted, gives a patience to explain everything, and there he goes. He picks up every good right clues which helps in his diagnosis. The second rule is touch, the power of touch. A simple touch can heal an anxious mind and infuse tremendous belief in you. It can be more powerful than the best prescriptions you can ever dream of. The third rule is minding the mind. Yes, belief really helps, but belief is subjective. Let's look at the power of our mind with some common scenarios. The same surgery is done on 2 patients, but the pain and outcome is different. This brings a big question: why? What's playing the devil here? When we studied the personality and pain, we found patients with more positive nature had better outcomes than those who were less positive. Interesting, right? This could be a perfect tool to address the mind. In this scenario, after post-refractive surgery, the status of mind can even drive the optics. This case, the anxiety caused a pseudo-accommodative spasm. On a serious note for us to reflect, Are we and our patients basically happy? A beautiful article on Happiness Project ranks country's happiness index and says that happier people are healthier. It's good news. Is it time to assess what makes them happy and patients healthier? The fourth rule is empathy. Empathy, especially in difficult scenarios, has tremendous healing power, and a testimony of a patient with untreatable visual snow just proves it. I did not treat her. She still has visual snow, but she's better. She's more positive about it. And that's the power of empathy. The final rule is holistic approach. Healing the mind by meditation and yoga activates faith and helps the body to heal itself. Let's look at the testimonials of these patients. From macular edema, CSR, uveitis, and many more. To sum up, the spokes of this wheel of faith usher in the most elusive aura into our practice. This video is dedicated to all our patients who teach us how to heal. Moving forward with our philosophy, your faith shall heal you. Let us continue to illuminate joyfully.